All right. Hello, everybody. My name is Elijah. I am one of the owners with Driven Dental Implant Marketing. We have Charles, the other owner of Driven Dental Implant Marketing. And we have, you heard me say it before, the Dr. Arun Garg here as our special guest. Nice to have you, Dr. Garg. How you doing today, buddy?
Fantastic. Thank you.
Good.
Welcome, welcome.
But I think it's extremely important to understand when it comes to dental implants, the first thing you got to do is know how to place them. So we picked, in our opinion, the number one person that is teaching dental across the world to place dental implants as the person to kick this off. I have a list here compiled of about 8 questions that we had asked to us, been asked for Dr. Garg to answer, and then you all can chime in with the questions that you have as we go through this. Charles, is there anything that you want to add to that?
Just that I'm excited to be here. I'm just really grateful for Dr. Garg joining us, and I had a chance to sit through a couple of his lectures when he was here in Chicago. And I have to say that, I'm not a dentist, but the people in the room were just blown away by the quality of content. Everybody was super excited about all the stuff they were learning, and so Dr. Garg is definitely the real deal. And maybe, Dr. Garg, if you could just start with kind of giving us a quick background of kind of how you got here and why this is your thing.
No, sure, absolutely. I was a chemical engineer undergraduate, and then I decided that wasn't my thing. I went to dental school, and then I decided to go down to University of Miami. I worked at the hospital there. I did a residency there, and then I stayed on as faculty at the University of Miami. And I was on the faculty for nearly 20 years, for 18 to be exact. And during that time, developed a lot of things. Implants kind of became my passion, my interest, and developed a lot of neat techniques, and published on those techniques. Over 150 scientific publications, and wrote a lot of books and trained a lot of residents. And I left the university about 5 years ago and went into private practice. And now I've continued what I used to do there but rather than teaching residents, I'm teaching folks in continuing education courses. I'm still writing articles, still developing techniques, still publishing books. So my passions are dental implant surgery and education. So this is like the perfect marriage of both. I get to do is implants and surgery, and I get to do education and train folks on it. And that kind of sums it in a nutshell.
Cool.
So, Dr. Garg, first question. Why should a dentist focus on mastering implants versus other clinical skills?
Well, what happened is when I started all of this is over 20 years ago, is most of the folks in the audience were oral maxillofacial surgeons. And then later on, the audience changed, and most of the audience was periodontists. And it really wasn't is a lot of general dentists is getting involved in this. And now what's happened is things have become a lot more straightforward. Things have become much more predictable. The patients demand that they would like to stay in the general dental office to get these things done. And for that reason is it's exciting for doctors. After 10, 15, 20 years of doing DO composites, it gets old, is for the doctor, for the staff. And so this is exciting, is to do dental implants. Is after, again, with PPOs and HMOs and they keep ratcheting the fees down, this is still fee for service. And so it's profitable, instead of having to deal with, and some insurance is trying to cover it, but even when they do, it's a very, very high remuneration. So it's profitable from both aspects. Is patients, a lot of times in general dental office, when they say, I'm going to refer you out, the patient goes, well, in that case, it's okay. I didn't really want it that bad. They trust the general dentist. They want to see the general dentist. And if it can be done in the same office, they more likely to say yes. They've got to go out. About half of them change their mind. And then what generally happens is the initial oral exam fee. Most general dental offices have a relatively low initial oral exam fee. Most especially have a very high or much higher, let's say, initial oral exam fee. The surgical fee is typically higher in the surgical office than the general dental office. So by doing this in general dental office, it allows the patient to be able to afford it a bit easier, which means more patients are able to get treatment done. So it's really all four of those things. It's exciting for the doctor and his staff. It's profitable, especially in these days. There's so much HMO and PPO pressure. Is patients don't get bounced around, is unless it's a difficult case that general dentist can't or doesn't want to handle, and it helps keep things affordable for the patient. So those are the four primary reasons is for general dentists to get involved in this.
That's cool. Hey, Elijah, maybe I'm stating the obvious, but I think this is one of the reasons that makes me most excited to actually to run the marketing campaigns that help dentists do more of this type of treatment is these types of treatments are typically the drastic transformations. These are the life-changing types of treatments and case studies, and they can be so rewarding to see that kind of impact on the patient. And I think that is also a big reason to really focus on this treatment. You know, a lot of people got into this into this industry to serve and help people, right? This is one of the best ways to do that in the biggest way possible.
Yeah, no, that should have been the fifth reason. Is this is not tooth dentistry. This is not a filling, a tooth extraction dentistry. This is life-changing dentistry.
Yeah.
Yeah.
Absolutely. What are the specific benefits of making dental implants a primary focus in your dental practice?
I don't know about a primary focus. What happens is, is in general dentistry, there's so many different things, and they're all exciting for a general dentist. And that's why most people went into general dentistry. If they'd want to specialize in one thing and make it a focus, they might have specialized. But the answer I guess from most general dentists is they enjoy doing a little bit of everything. So they can continue with implants. They can continue doing fillings. They can continue doing crowns and soft tissue management and some extractions and some endo. But with that said, it doesn't have to be either. It's going to be a full focus and a implantology practice or nothing. And I think oftentimes that's how folks viewed it. That either I have to make this my focus and do this almost full time or not get involved. Whereas I think there's a continuum from here to here. And folks can say, well, maybe in the past I chose nothing, but I can do 20% of the easy cases and still continue to refer out 80%. And another individual may say, I'd like to do 40% and refer out 60%. And another one may say, I'd like to do 60%, refer out 40%. And so on. And so for some, they would like to do 80 and 90, 100%. And for them, they'll have to take more advanced education and really make this a focus of their practice. And but for most general dentists, this should just become a part of their office. Just like they do some extractions, refer the rest to the specialist. They do some endo, refer the rest to the specialist. They do some perio, refer the rest to the specialist. And the same with dental implants. They can and should do some of the dental implants and refer the rest of them, should they choose to. If they want to focus, that would be up to them.
Absolutely. What is the best way to learn dental implants?
As far as learning is implants, like learning anything. I mean, the first place to start is these days there's so much information out there. You can go on the internet. You can go on YouTube. You can go on Facebook. You can read books. And that's always the first place to start, whether you're trying to learn skiing or learning implants. It's laborious, of course, is to shift through all the Facebook postings and YouTube postings and then try to making sense of it, because what works and what doesn't, because a lot of opinion out there. There may be fake news out there, okay? And so you got to sort through it yourself. Textbooks is another good place is to get started. But when one gets serious, just like you wouldn't really learn skiing simply from a textbook, you wouldn't learn anything simply from a textbook, then the next step is getting some is education on this. And that education is typically takes the form of lecture. It could be online, but typically is face-to-face, because with lecture format face-to-face, it allows the opportunity. I didn't understand that word. I didn't understand that concept. And if you don't understand the word or concept, raise your hand, get it explained. So every concept that builds on it from there on is makes sense, because that word or concept was explained to you. And then that follows up with hands-on workshops. None of us could learn skiing or riding a bicycle or playing tennis without ever getting on a bicycle, without ever getting on a tennis court, without ever getting on ski. And so it would be gauging your interest through books and Facebooks and YouTubes. That's fine. But then when we get serious, didactic and model workshops. So didactic and model workshops is critical. And that may be it. You know, for a lot of people, didactic and model workshops is pretty much it. Is beyond that is could be mentorship. And so if we do didactic and is model workshops, and then to say, you know, if a doctor says, well, is I've taken your lecture course at Garg, I've taken your model workshop with you supervising, could you come to my office and supervise me doing a patient? And the answer is actually yes. Or could I come to your office, Dr. Garg, and observe you treating patients? And the answer again, yes, but that would be the next level. So at the very least, lecture and model workshop. And for a lot of folks, that's enough. For some folks, mentorship, apprenticeship is come to our office. We come to your office is, and then just over time is practice.
Cool. Well, I obviously there's a lot of different ways, and actually, I mean, everybody's learning style, like you said, is a little bit different. And by the way, if you all are looking for some help, and maybe, well, what is the best way I should go about this? You definitely contact Dr. Garg. He's got a whole team of people that can kind of consult with you, have a conversation, and help you figure out, well, what's the best mix of these different types of methodologies to start your journey. But Dr. Garg, what do you think about this? I think another thing that's important is maybe community. There's so many different distractions in trying to run a dental practice and to grow your business, and you can get pulled in so many different directions. Having a whole group of people who are also focused on learning the same thing, kind of progressing their journey with you, can definitely enhance the speed, I think, of your mastery. Would you agree with that?
Oh, I absolutely is. You keep coming up with all the things I forget to say. Now I see why there's all three of us on this podcast together. Is that would be the other thing, of course, is a community. And because then it's the same guys in the class with you. You're progressing, you're sharing ideas at the lunches, at the breaks, at the happy hours, and progressing together, pushing each other, encouraging each other is sort of your own tribe. And that is your classmates in the class. And then eventually it becomes the alumni. And we have an alumni organization. Folks join that. We have alumni get-togethers. We offer them 4 times a year, alumni get-togethers. And for that camaraderie, for that tribe.
And now I just have this question. You have such a positive, strong following. And, it's actually very impressive. How many dentists have you trained to place dental implants? If you had to put a number, you might know the exact, you don't have to give it, but I'm just curious. How many dentists have you trained to place implants?
Oh, that have gone through a long-term program. We're not talking about a symposium where there's 1,000 people sitting in the room and a half-hour lecture. That doesn't count. We're talking folks that have spent a year with me is over 10,000 people.
Wow.
Yeah, over 10,000 people that have done apprenticeship and mentorship and me going to their office, them coming to my office, my patients, a year of training month after month after month, over 10,000. Yes.
Wow. And I don't know if Brian Motts posted this. I'm going to go ahead and show what this is. This is crazy. He said, since after taking his course 4 years ago, I have placed and restored over 500 implants. It was the best investment I ever made. I mean,
congratulations.
High five, Brian. That's awesome. Thank you for sharing that.
I think you could probably do the return on investment.
Yeah,
because the general dental office, it's the crown, it's the implant, the abutment, the crown, probably $3,000 to $4,000 each at least. So $4,000, let's say, times 500 implants, $2 million. Is that right? Okay, $2 million return is on his educational investment.
Man, that's crazy. And it's like this. We take little clips of this video and we essentially put it into a little thing to grab on Facebook or a little comment. I think your picture with I have taught over 10,000 dentists through a 1-year internship or apprenticeship, whatever you called it. That's impressive.
Yeah.
I mean, that is impressive. And then to take that number and say, what is the average amount of implants they place? I wonder how many people you have affected human beings, right? Because you're thinking on the higher level of, I'm going to help thousands of people who help thousands of people. I think that that's a awesome, awesome effect. But yeah, you have a tremendous reputation in the industry. And I was just curious, because every single time somebody posts anything about Dr. Garg, there is always a whole bunch of people who reply to it saying positive things. So kudos for being you. So my next question, why has Implant Seminars been so successful, and why is their methodology most effective?
I think we talked about the things that have to be done but they've got to be done by a true educator. There's two things. One, someone could be not talented and not educator. I mean, that would be, the worst investment. You go to someone, he doesn't have a strong background, doesn't have a 20-year background, has a 1-year background, 2-year background, 3-year background, just graduated himself, placed a few implants, is not a true educator. That would be a terrible investment. But the second thing is getting trained by someone that has maybe placed a lot of implants, but is not a true educator, is not the same thing as someone who's actually placed thousands and thousands and thousands for years and years and years of implants and is a professional educator. The analogy I think of is when you think of, we all know folks that were in the NBA or the NFL, and is folks that are phenomenal players and they are not good coaches, or went into coaching and weren't good coaches. And we all know the opposite as well. Folks that actually were players, maybe not the best players, but went on to become excellent coaches. And so playing skills is one skill set. Coaching is a different skill set. And just because someone's a good player doesn't mean they're a good coach. Now, if you got both great player and great coaching, and I think that's been it, is we've been great on the player side, doing excellent surgeries, writing about them, developing techniques. But more important from an educational perspective, been excellent coaches, is to be able to take people and effectively get them trained to implement things. Is not where folks will go and say, well, it was a lot of great information. It was fun. He was fun. He was a nice guy. We went out drinking. We drank bourbon. We drank flavored bourbon. We drank this. We drank that. But in the end, I didn't do anything. Okay? This is about getting folks trained. Great coaching and great playing. And I think that's is the synopsis of it.
I think that's a great analogy. And I would add to that. I mean, when you think about a great athlete or a great, athletic coach, I mean, even someone who is not an expert in that particular sport can kind of look at their performance and just tell right away that they're good at what they do. Like you don't have to know the ins and outs to be like, that he knows what he's doing. Like you make it look easy. And I can say that was my experience from the courses that I sat in while I was here in Chicago. And I think just the way that you structured all of the information that you share makes it so easy to absorb. Like, again, I'm not a doctor. I don't sit into these kind of stuff, but I was able to kind of understand what was going on. And that's, I think, a testament to the ability to teach, is that you made it simple and actionable and kind of just the right information.
I liked having you in the classroom.
Yeah,
I liked having you in the classroom because I was directing my lecture towards you. I could train everybody in the room. Absolutely.
I doubt that's the case, but definitely, I'm just saying I was impressed. And one of the things too, that here's another takeaway I got from that, is just where you're drawing from all your information. It's like your time at the university, like you have pretty much tried all of these different methodologies, and then you just lay it out. Here's what works, here's what didn't work, and then here's the best practice. So a dentist can go to your course and they don't have to make all the mistakes. They know exactly, here's the best way to go. But, a lot of dentists kind of just want to know, well, what else is out there? You actually break it down and show them, here are all the other options, and here are the results that we got from that. So here's why you don't want to go in this direction. Do this, and this is going to be the best way.
I'm not sponsored by any companies at all.
Yeah.
And that's the other thing. A lot of times what happens, education is put on as education under the guise of an infomercial for an implant company. And for that reason, I take absolutely no sponsorship. We're doing these podcasts, we're talking to folks directly It's not an implant company doing them on our behalf to drum up his registrants and such. And without that, I'm free to try all the different systems. And I try all the systems and try all the graft materials and all the membranes, and can guide them on whatever choices they choose, and also can speak to what's good about this system, what's not good about this, what's good about this one, what's not good about this one, and the pros and cons of each, rather than just focus on this is what we use and this is what you should use, and I don't know anything about anything else, which I see so commonly in the industry. And so we can actually work them through the positives and negatives of each and every one of these, and then help guide them to make their own decisions, what's best for them.
For sure. They get that foundation so they can make their, like you said, they can make their own decisions and really be in charge of their own journey. That's great.
Yeah.
I think that sets you apart from a lot of speakers as well. And I'll tell you my true testimony to it. There is a implant system called UltraTooth. And I said, Dr. Garg, can you tell me what you think about UltraTooth? And I didn't say I'm working with them or I like them or they happen to be an exhibitor on my cruise. Only thing I said is, what do you think? And you gave me the exact, it wasn't, because I thought that another implant company probably snatched you up as this is only who you're going to talk about. No, that's not the case. They have a different system. I like it. The people behind you are good, and you gave me your feedback, but it was all good feedback. It was quality feedback, and you weren't biased by saying, no, use this company or use that company. And I was just impressed by the non-bias answer.
Right. Thank you. Thanks.
Absolutely.
Yeah.
So the next question is the details about each of your courses. So, each of your courses are very, very different, and they're all very value driven. Can you tell us the details about each course and how a dentist would progress through them? I have listed here Implant Unlimited, Implant Continuum, Implant Mastery, and the Live Patient course. Can you tell me about those, each course?
So we're talking about as far as coursework. So like I say, it's not a step-by-step progression. Is we offer a variety of different things, and one is the 2-day program. The 2-day program is a half a day on treatment planning, on patient evaluation, on socket grafting, on step-by-step implant placement, model workshop, and it's being offered in 5 different places in 2018. Is Houston is already over, Las Vegas is New York, Orlando, and on a cruise to the Bahamas and Cuba. And so those are the 5 locations. And that's enough for folks to get started, to do socket preservations, to do simple implants. And that's an appropriate course for that individual. There are some folks who say, well, I'd like to do more than just the 10 or 20% of the implants. So they would take an alternate pathway. They wouldn't go from this to it. That alternate pathway would be an 8-day implant continuum. And that's offered in a number of cities around America. And that's 8 days. And that covers of course, implant step-by-step and treatment planning, also soft tissue management, also step-by-step prosthetics, also how to close cases, also how to manage complications. And that would be for the individual that wants to handle about 40 or 50% of his cases and refer out the other remaining 50%. There's another course called the Implant Masters Series. And the Masters Series is for the individual that's already placing implants, has placed at least 50 to 100 implants, and possibly more, maybe 500, maybe 400, but at least 50 to 100. And they'd like to do tougher cases. They'd like to do sinus lifts, and they'd like to do ridge splits, and they'd like to do bone expansion, and they'd like to do meat extraction implant placement. And so they would then take that, and that way they'd probably do 70, 80% of the cases themselves and refer out maybe 20, 30%. And there are those individuals that have already placed 500, 600, 700 implants, already doing sinus lifts, already doing bone grafts. And they may say, well, I'd like to do the all-in-4 type of concept, or I'd like to do chin blocks, or I'd like to do ramus blocks. As I like to do is very finesse soft tissue as management, and they would take what we call the Power Series as so is separate programs is for those that say, well, is I like didactic and models, but I learn best by working on live patients, is then they can do live patient. Is we built a dedicated training facility in Santo Domingo, Dominican Republic. It's 26 demo chairs, a freestanding 3-story building, and brand new American CAT scanners, American CEREC machines, American lasers, endoscopic is endodontic microscopes are all there, and is come down and do implant placement, is under supervision, one faculty supervising every 2, maybe 3 chairs, and you and your partner doctor place 20 implants each, so 40 implants between the 2 of you. And if that's what you need, you take that. And some people may take a combination of things, but that is not required and mandatory at all. That's where, when they call us, we can guide them into what would be the best solution for them. And what's happened is, after that, so many of our alumni, because we've got to over 10,000 alumni, they've come to me and said, well, we'd like an oral sedation course. And I said, well, I'm not going to do that, but I'll hire the best oral sedation guys in the country, and they can put it on. We'll do a co-venture with them, and we offer that now. And folks said, well, Garg, you do the Botox and fillers. We'd like a course on that. And we started a course on that where I do the training, but the implant and the sinuses, I do 100% of training. On the Botox, I do about 30% and bring in guest faculty, the other 70% of it. And then we had requests for soft tissue, small incisions for gingival recession, and doing it without major incisions, without major bleeding and such. And we brought in a guest faculty, partner with them, and we offer soft tissue management courses. And so there's 25 different dental-related courses put on where we've co-ventured with folks, and they're doing the bulk of the training, and I'd be doing a minor portion of those things. So is pretty much everything they could want is technical training we've got to offer in one way or another for them.
Absolutely. This is another testimonial that I just can't hide. I gotta show it. So this is from Russell Mann. He said, completed his entire curriculum in approximately 3 years ago. Started with the basics of socket preservation and grew my implant practice from there. Last year, we produced over 450,000 in implant services alone. Best decision I ever made since dental school. Has changed my practice and has changed my life.
Yeah.
$450,000 a year, third year out. Congratulations, Dr. Mann.
That's awesome.
I mean,
450,000 additional dollars just on the implants a year in his third year. Yes, man. Phenomenal.
Yep. I mean that's what you do this stuff for, is to change people's lives. And think about it. He might have had his own life change, maybe because he made $500,000. But I think the bigger picture is how many people did he actually give a life to that they didn't have with that smile?
Exactly. Yeah.
And
that's actually, Elijah, that's what keeps me going. Is if you read if you haven't read my Implant Excellence book, I'll send that to you, and that's what I talk about. I wrote that about 6 years ago. Is what keeps me going, because it is hard work. What keeps me going is the lives changed. If I can change 10,000 lives and impact those 10,000 lives of doctors, and if each doctor impacts 1,000 patient lives, wow! I feel like directly or indirectly, I touch 10 million lives. Is when you do the math on that. So one day when I'm up there with the big guy, okay, I can say, okay, I changed 10 million lives I touched. I might have messed up a couple of times along the way, but weigh this, okay.
Absolutely. That's awesome. The next question I have is, and I know we talked about this, but we're going to Cuba November the 15th to the 19th, and we're having an Implant Seminars Cruise. And most questions that we get about that cruise is, who should come? What is the right dentist? And it is a cruise specifically for dentists plus their spouse and one team member. It's not a big smiles at sea cruise like normal, but it's a very focused cruise specifically on the implants. Can you say, who should be the person to come to that cruise? Because it's not everybody.
Well, is a couple of things I got to point out. Remember, I said that 2-day course, Implants Unlimited, we're doing 5 different places. Houston, is Las Vegas, New York, Orlando, and on the cruise. Would love to have anyone at any one of those cities. No, okay, Houston's already over, but the others. But I got to tell everyone that's watching, on the other cities, they don't get, in addition to myself, Elijah and Charles. Okay, so we focused on the things I'm going to train them on, but you guys haven't focused on that. On the cruise, I will do all of the same material, but plus you get Elijah on team building. Plus you get Charles on how to drive implant patients to your practice. So you get the 2 bonuses on the cruise that you do it in the other city. Number 2, of course, it's a cruise, the biggest bonus of all. And we picked the cities. We picked the country. We specifically said we want the Bahamas and we want Cuba. And so plus to get that is, along with the CE, is, and of course, the camaraderie at breakfast, lunch, dinner, is outings and such with everyone there. And so a lot of wins is on that particular thing. As far as who's going to be there, this is for folks that are interested in implants, absolutely, is in any way, shape, and form. And what we did is we made this such a reasonable cost, is, I would even say, dare say, a low cost, is because we don't want that to be the barrier. Okay, cost should not be the barrier at all. We made a 4-day cruise. They don't have to take 10 days out of their life, or 7 days, or 8 days out of their life, because time should not be a barrier. So we removed every possible barrier is there. So everyone's interested in implants. You say, maybe not so interested in implants. I'm interested in the cruise. Great, we'd still love to have you. All right, so if I'm already doing some implants, I'd like to finesse my technique. Great. I'm already doing some implants, but I need more patients. Fantastic. We got Charles there. I'm doing implants, I got enough patients, but I'd like to get my team more excited about it. Great. Elijah's going to be presenting there. So if you want to help your team members, if you want to get more patients, if you want to learn this, if you want to refine your technique, if you want to have a good time, any one of those 5 or all 5 of those, we're offering all of them.
Absolutely. Thank you for that, Dr. Garg. And we didn't talk much about the team, but I think it's very important. I think it's very important to touch on that. So you can be a dentist, the best dentist in the world at placing dental implants. However, if you don't have your team to support you with doing those implants, you will not be as successful as you could have been. We'll put it like this, because your team is taking the phone calls. Your team is walking your patient back. Your team is getting the information that they need to present to the doctor in the first place. Your team is going to talk you up as a dentist, or should talk you up as a dentist. Your team is going to be going over the financials. And if you don't have one of those pieces to the puzzle, then your house isn't in order. And so that is what I will be speaking on, is the teams, which is extremely important. Now, here's another really cool thing. Something that we will be doing every week is we'll be bringing in the expert on all of these items. This is what we're doing these podcasts for. So Dr. Garg, he can tell you exactly how to be successful from placing the implant. I mean, heck, he teaches you how to do it. He has blood on his hands. He knows how to do it, right? Now, there's other people that talk specifically on financing, or specifically on answering the phone, or specifically on case presentation. And so we are very excited to be having these interviews. And more than anything, we're super duper excited to have you kick these off, Dr. Garg. Brian has a question for you. So I'm going to go ahead and ask that question to you. He says, I'm mentoring a large group of dental students at the University of Maryland Dental School, and one of the most frequently asked questions I get is how and where graduates get training they need in order to offer implant services in private practice. Dr. Garg, what do you suggest?
Well, what we just talked about is this entry-level course, Implants Unlimited, 2 days, is we make it cost-effective, easy, time-effective. Is like I say, we remove time and cost as a barrier. And their students, I would be delighted to help them any and every way possible.
Absolutely.
Yeah. Hey, I want to add to that. Dr. Garg just laid out his entire catalog of training. Like, obviously, you've got something for everybody on every, spot on the spectrum. And I think a place to start is even just a conversation with you or with your team, because you can kind of help them assess where they're at and kind of even just map out, like, well, what if I'm going to plan my own mastery of this, what would that look like for me? And I think a conversation like that would be extremely valuable, and it would just create so much clarity for someone who's really focused on doing more implants.
Oh, very good point. Yes. Yeah. Start with the conversation. Yeah.
Absolutely. So where can everyone go to get more information about your courses and about the cruise?
For the whole slew of courses, the easiest would be implantseminars.com. For the cruise is drivendentalmarketing.com. Is either one of those. And, if they want to talk to me personally, is whoever answers will steer them to me personally. If the team members can answer the questions, they'll answer the questions. So drivendentalmarketing.com and or implantseminars.com and or a discussion with me.
Absolutely. That sounds good. Charles, any last words? Anything that's you always have your mind going. You're most and when you say something that's super powerful, me, I just keep talking. No. But Charles, anything that you want to add?
Two things. One is we will actually put a link somewhere in the information page on the cruise where you can just fill out a short little questionnaire to facilitate the conversation if you are interested in talking with Dr. Garg personally or someone on his team. So go to drivendentalmarketing.com, find the place about the cruise information, put in your information there, and that's probably the fastest path directly to Dr. Garg, and that will be up very shortly. And then number two is just, I wanted to add about the marketing. You had a chance to kind of quickly just talk about the importance of the team. I think the third piece to this whole puzzle is to also have a system in place to stand out in your marketplace as the provider of choice for dental implants. Once you go through all the effort to actually master this clinically, and now you have this ability to change lives, if patients can't find you or they don't know that you can do this, you're not going to have the ability to deliver. And so your marketing is a critical piece, especially in, there's some competitive markets out there in the country, and, it's not an easy thing to stand out. And so you need to work with someone who understands this and has a systemized, proven way to put you out there. And so also, as you are learning, when you increase your case flow, that's going to accelerate your mastery of this whole thing. Every single case that you get is going to be another opportunity. So whether you're starting at the beginning and you're only able to do 10 to 20% of the cases and you're going to refer out the rest, or you're at the end of it and you're doing the majority of these yourself, you still want to increase your case flow because you're going to get better with every single one. Your team's going to get better with every single one. And it's not just the clinical part. It's the mastery of the phone. It's the case presentation. It's the pricing and all of that. Every single patient through your door helps you master all of those systems. And so getting your marketing in place is the beginning to all of that. And so as you're looking at planning your mastery of implants, think about marketing because it's really important.
Man, Charles, I think Dr. Garg said this earlier, like, you think of everything that we were supposed to talk about and you fill that in. And, Garg had an amazing timeline. He said something like, after you take my courses, you have about a month or so to use your skills, and then 2 months, then 3. So, Dr. Garg, I don't know if you remember that conversation. I don't remember when it was, but you had a timeline. Basically, after someone goes to your course and they want to start placing implants, what does that timeline look like? Why would they want to do
start immediately? No, they start immediately. Pardon me? Why wouldn't they want to? Yes. Is the site preservations they've got in their office is the implant cases. They got to start finding the current patients, and they got to get more implant patients in. Yes,
absolutely. And you had mentioned something along the lines of you come and you learn all of this great stuff, and now you have to use it. So if you don't do it for about a month, there's something. If you don't do it for about 2 months, there's some. If you wait 6 months till you get your first case, do you remember this conversation?
Yes. So I said is yes, you know the most the day you finish, and then what happens a month later, you're a bit more stale, and 2 months later, even more, and 6 months later, you're not going to do it because you're going to feel too rusty. And so you've got to start doing these things immediately upon graduation. Okay. And I think that's the point you're making is in order to get started, you got to have marketing and have the patient volume to get started immediately.
Yes.
You got to start immediately. Yeah.
Absolutely. And Charles, you are, I should say we are actually offering a free strategy session.
Yes.
For
sure. And we can talk about maybe how to identify opportunities internally inside your practice right now. There's probably patients, where you can start, doing more of this immediately without any marketing spend. And then obviously we'll have a conversation about what's the best approach to start driving patients to your practice, and on those lines, Dr. Garg, when you're saying, the most the day that the day you finish, you probably want to start your marketing before you finish the course so that you've got patients already lined up. And so you can go put that to work immediately. And on this line, Elijah and I, we've talked about this, but it's not official yet. We actually said, why don't we even offer maybe a scholarship to the people that join us on the cruise that are just getting started. If you want to start with Driven Dental Marketing, there may be a way for us to actually pay your tuition for that cruise. So schedule a strategy call with us, and we'll tell you a little bit more about that. Just want to say that there's an opportunity there.
Definitely just removed every single barrier right there. Okay, now there's no excuse.
Hey, Charles is over here offering these crazy. Charles didn't even run that by me. The whole world, you can't hit rewind, erase. You're offering people to pay for their course if they sign up with Driven Dental. Oh my goodness, we're gonna have a talk after this. Yeah, so all right, we're gonna say goodbye to Charles. So no, just kidding. Hey, but listen, it's been good, Dr. Garg. I can't wait to have you back on our live cast to actually discuss in some details anything, whether it's socket preservation or membranes or sinus lifts, whatever it may be. We're excited to have you back as a reoccurring guest. I mean. Dr. Glenn Bogue calls you the OG of dentistry, of implant dentistry. Isn't that awesome? If anybody knows Glenn, he's an amazing, amazing guy with Nifty, Thrifty Dentist and Dental Garage Sale. But anyways, thank you for coming and being a part of this. I think it's been an excellent very first live cast. So, yes. Dr. Garg, you'll be able to say, I did the first one.
Yeah. Man,
and we'll be able to say we had the Dr. Garg on our first live cast. So, hey, thanks for being you. We love your personality over everything. Everybody loves you. Thanks for being a champ and coming on live with us today. I appreciate it.
Great. Thank you.
Thank you. Really enjoyed it.